The problem is that people do not screen because there's no pain. And people wait for pain and symptoms before they go see a doctor. This is where I am. This is how I feel. I'm not canceling. I'm rescheduling it because mentally I'm not in the right frame of mind.
Yes.
We're talking about the vagina.
Because it has a name.
No one must touch your vagina.
Yeah.
Your vagina is your private part. Let's keep it like that.
Thank you so much for tuning in to Numbers Don't Lie. We're excited today because indeed numbers don't lie in a woman's life. And sometimes we don't reflect and really understand that we are about numbers as women, even as we grow from childhood to whichever age. But today we're going to break it down nicely, those numbers, with Dr. Koketso. So Doc, I've seen that you call yourself the voice when no one else listens. So what shaped that story? How did it come about? Just in a nice introduction.
Hi to the audience. I am Dr. Koketso Pule, an obstetrician and gynecologist by profession. What I mean by that is really just being an advocate for women's health and wellness, as well as women's rights. So mine really is to be the voice for women where they cannot advocate for themselves, to educate and empower, to give women that voice. We are always, most of the time, we are the ones carrying the burdens of society, nurturing, mothering, and still working, and then putting ourselves second in line. So I just mean that my passion is just being an advocate for women in all aspects, really.
And that passion, what inspired that passion? Is it like when we're young, you just wanted to be a doctor? Like me, I wanted to be a doctor.
Being a doctor is something I grew into because growing up from the background I was, when I had to decide going to university, I thought, medicine takes so long, I need to work. At least something that takes minimum 3 years to study to be able to help my family out. Yeah. But during my first degree, which is biomedical health sciences, I grew to love medicine because it allowed me to interact with people, help people. The thing that makes me feel good inside is really me being able to make a difference and impact someone's life positively. Yeah. Seeing someone else happy, fulfilled makes me happy. If I can do that for someone in any positive way, that's what I wanted. So that's how I grew into medicine and interacting with other people who are studying medicine, and just the idea of it, just being an advocate for overall health and making a difference was what drew me to it.
So I have a grade 12 learner in my house. Mm-hmm. Yeah, we are deciding what she needs to do. Obviously influenced by mom, yes. But otherwise there's a grade 12 learner and they want to be in medicine. What would be your advice, just a quick advice to that young, excited person?
To the young, excited person, choosing a career, really, you must start with knowing yourself, knowing your strengths, and working from those strengths, right? It mustn't be because the world or society deems medicine as a more esteemed profession than any other profession, or you feel coerced into making that choice. You must have a passion for people. You must do it because you like it, you love it, you see yourself being a doctor in future. Even though there are different aspects of medicine, it must be your choice. Yeah. It mustn't be because of the influence of what you've heard or what you've seen. Do your research and see if it ticks the right boxes for you.
Yeah, definitely. Thank you for that, Doc. So now let's move to the woman herself. When does it start? Because for me, obviously going to the gynae started when I was pregnant. Then I realized, okay, I need a doctor who deals with women. But otherwise, I think it really has to start early. Mm-hmm. Yeah. So what is your experience? How is your advice in terms of when should we start? Especially for me, I have my teenager. Maybe we need to start such conversations, which I don't know. But we'll wait until maybe she's pregnant. But we need to do it early.
Yeah. So I don't have strict numbers to when a girl child or a woman must start seeing the gynecologist, right? When a girl child is in the mother's womb, they are developing eggs, a set number of eggs. They start in the millions, and when they grow, as they grow, those number of eggs deteriorate in number until they become menopausal and stop going into their cycle. So as a child is born, into them growing. Like a girl child, average age of going into or starting a cycle will be the age of 8. But before then, a girl child can have issues around their pelvis, the vagina. So issues can come up even when they're young. I mean, my own child had what we call pediatric vulvovaginitis, just meaning that the skin on the vulva is thin. It doesn't have the right hormones as yet. It becomes thin, it cracks and is prone to itching. I mean, I knew what was happening just because I was a gynae.
Yeah.
But as a mother who's not in the medical profession, you might not know what's going. And that will be an opportunity for you as a mother, if you're not sure what's happening with your child's pelvic area or vaginal area, to get in contact with a gynecologist. If that doesn't happen, when the cycle comes, the menstrual cycle comes or it starts, or you're uncomfortable to have that conversation with your daughter, that's an opportunity to visit the gynecologist. We will make that conversation easier for you, explain it in a language that the child understands, and make it an easier conversation to have. When teenagers start also having their cycle, just hygiene around that, we can facilitate those conversations around sexual health when someone starts being sexually active, or even if they're not sexually active, when parents are shy to talk about those things. The gynecologist room is a safe space to start talking about those things. When girls start developing breasts, and we are conversation starters. We provide safe spaces for conversations like that. And in your mid-years, into your 20s, people are curious about contraception use. So we offer different forms of contraception. So the counseling can start in our rooms, and then we can offer a variety of options in terms of that. And when a woman has irregular cycles, heavy bleeding, excruciating period pains, we provide safe spaces and solutions to those issues. Because women, as they grow, especially the Black woman, we are prone to getting fibroids, which are overgrowth of the muscle layer of the uterus that can make your periods very painful and heavy. So there are a lot of issues, fertility issues, people struggling to fall pregnant at any point in their lives. We are there to provide support and solutions to couples as well, into transitioning from your womanhood, perimenopause, into menopause, and after that. So really, we are part of a woman's life from the time they are conceived in the mother's womb.
Yes. Thank you for that. Myself included, I wouldn't be here if you guys were not there. We'll talk about that. But that conversation, I'm one of the mothers, obviously from a background in the villages, we don't talk about these things, we don't talk about this. Mm-hmm. So I'm one of the mothers that it takes a lot to really talk to Nsobo about her sexuality. So to break it easy for mothers like me who I don't know where to start, but I need to have this conversation. Which questions, how can we make it a bit bearable?
So what I always advise, if I was to put myself in a child's shoes, what I wouldn't advise is to put a child in a seat, in a corner, make it seem like it's a very deep, difficult conversation. So as you see a child growing and maturing, you're seeing that the body is changing. You incorporate the topics that you want to sit them down and talk about into your everyday life and make it familiar to them. Either you start relating stories to yourself, what you're going through, how you dealt with issues before you have a formal conversation with them. So ease them into a topic. It mustn't be that one day your mom is now sitting you down. You'll start feeling like you did something wrong or you're in trouble. So let's say, for instance, your daughter is approaching a time when their period is supposed to start. Then you start exposing them into your space. You start telling them what pads are, what happens in a woman's life, when to expect it. It must be an everyday conversation. You start it soft and you build it up. Yeah. And when that time comes, but when you sit them down, at least then they have an idea and you don't instill fear in them. You normalize it, you break the myths around it. Do not talk about it as if it's a taboo topic, and they mustn't feel fearful to open up and talk about it. So make it part of your everyday routine. Introduce it slowly and softly so that they acclimatize steadily. So before you have the actual talk with them.
considering that we live in a social media space where there is a lot of people talking to our girls.
Yes.
So we definitely need to make it a daily or a very serious, crucial habit of talking
Yes.
about these things.
Yes.
And what do you see where social media misinform a lot of us as women?
Yeah, it's the TikTokers, the Facebook, but it's not just that.
Yeah.
Not all published material or articles are fact. So yes, we read, yes, we research, there's a lot of information and misinformation out there. When you have a question and that may affect your life or your health outcomes, or you are worried about something, it's always better to sit down with an expert and get an opinion or gather the information, write down the questions, see a healthcare professional. I'd assume the reason someone would research or look for information about something is because something is either bothering them or they have a curiosity about it. So as I say, not everything you read and see is fact. Rather sit down with an expert that you can see and converse with and have a discussion. Write down all those questions that you might have or have gathered from TikTok and speak to your healthcare professional about it, or an expert in that particular field, be it medicine, accounting, or anything. Look for someone you can trust to discuss that topic.
And it's really about being proactive. So most of us wait until something happens, then we run. I'm not sure what is that, but we will have to break it. We need to really invest in finding knowledge and really finding it to the right spaces. So thank you for that. In terms of finding knowledge at the right time, most of us, we don't, because we don't do screening.
Mm-hmm.
So what is the importance of screening and how often do we need to do it and what it entails?
So screening is what we call primary prevention, right? So looking for a problem or something that may be amiss before it becomes an actual serious disease. So screening really saves lives. So let me make an example with cervical cancer screening. So cervical cancer screening entails us doing a pap smear. It's a screening test because it does not confirm a diagnosis. We do a pap smear, which is essentially as getting a sample from the mouth of the womb, the cervix, and we send that sample to the lab and they check whether those cells or sample we've collected has any abnormalities or not. It will tell you, it's like an alarm that goes off, right? It will either then tell you there is an abnormality, being it the virus that can make the lining abnormal, or the lining on the mouth of the womb is abnormal. This is before it becomes cancerous. It's a screening. It says something is off, but I'm not sure what it is. Let's investigate further. So if your pap smear is abnormal, then we can do further testing depending on what the abnormality is. It's a screening to say there's something wrong. Let's investigate it further. I liken it to someone, like you see we are sitting here.
Yeah.
If someone wants to know what I look like, if they're looking through a window, they don't see me directly. Screening is like that, right? So for you to see me directly, you have to open the door and see me physically. Then you'll know, oh, am I light-skinned, or was it the lighting outside, or are there pimples on my face? Yeah. So screening is like that. It's like a look from outside the window. It looks like there's something abnormal. If there is anything abnormal, let's investigate it further, confirm or treat the abnormality.
Yeah.
So if a pap smear is abnormal, we either treat the abnormality before it becomes cancerous, right? The problem is that people do not screen because there's no pain. And people wait for pain and symptoms before they go see a doctor. The reason there are screening programs is to prevent problems from becoming bigger and uncontrollable or untreatable. Yeah. Because by the time you start bleeding or having a foul-smelling discharge, it's because there's already a growth that's eating away at the mouth of your womb, the cervix, that has now become cancerous. And had you done a pap smear or screening before, we could have prevented that.
And I think just thinking about it, obviously at a practical level, could be the shame that comes with like women topics. Obviously, some of us can't even mention the V word. Yes. We're like, okay.
Vagina.
But it's something that it's a daily exercise. Yes. We actually get a lot of a lot of things done, obviously giving birth and all, sexuality. So what are those shameful topics that we still really shy away from and we really need to focus on when it comes to women's health?
Well, first, the problem is that the pain that we get, the pain that we go through becomes normalized because somehow, somewhere, some women, or might have been a man, who said that it's normal for a woman to have bad period pains or bleed heavily so and normalize it. It's like, yeah, my grandmother went through that. My aunt went. Just because someone else went through it does not make it normal. Okay, so it's just about debunking all those myths and providing safe spaces for people to talk about their sexual health and their reproductive health. The one other taboo that I don't like is when a couple is struggling to fall pregnant, it's always blamed on the woman. Okay, fertility is dependent on the women and the men themselves. You find that the woman is the one that comes into the consultation room. I've been married for a year. I can't fall pregnant. Mama Zala is blaming me and is asking me the question of when I'm having a baby. Okay, men also have reasons or they contribute the same as women towards the causes of infertility. Okay, you'll find a man who is ejaculating, but within the semen, there is no sperm. You won't know unless we send you for testing. Your tubes, a man's tubes can also be blocked and not be able to release sperm. Men also have hormones that regulate their sperm production. The man's hormones can also be defective to a point where they are not producing the right sperm or the right amount of sperm. So the taboo really is around fertility issues and the causes of infertility. So we need to approach these issues with tact and empathy at times if needs be, provide safe spaces and have these conversations and debunk all these myths, because that's why some people and some men don't even consult, because somehow they feel like it affects their masculinity, which then delays treatment and them seeking help.
True. And you find that because we operate in like similar spaces in the workplace, you find that sometimes workplace performance can be linked to women's health. But how do you then bring it forward to say, you know what, maybe this performance issue is also related to women's health and just go deeper into it? For example, I was pregnant and my pregnancy, we didn't know anything about like issues of pregnancy. We just excited about the baby. But we realized that at some point I had preeclampsia and it got complicated. And I continued working, and then at some point I had to be bedridden and things like that. And it would affect your workplace performance. So how can you help leaders to really just look into these things with clarity and, like you said, with empathy?
Yeah. So it's having the continuous conversations and including overall holistic wellness in company wellness days, talking about women's health, talking about men's health equally so. But I think as women, when you understand your body, when you understand that you are at your workplace because you work to get there, you are as deserving as the next person. And yes, you are a female. The man is a man because they are a man, but you are there because you work to get there. The problem that I tend to see, that I have a gripe with, is us walking into workplaces and trying to diminish ourselves or use our womanhood or see it as a weakness. When I walk into a workplace knowing that I'm a woman, I'm going to have a menstrual cycle, I might have PMS, I'm going to be pregnant, I need maternity leave, the man will have paternity leave. Understanding myself, understanding my strengths and what I offer, my strengths and my credibility at work. Once I stand firm on that and understanding who I am, my womanhood is not going to be my weakness. It is my strong point. I can bear a child and carry the child for 9 months. That is my strength. And if I need time off, I'm not going to be shy and timid about it. It's because I am a woman. If we acknowledge ourselves and our strengths and understand that we deserve the chair, we deserve to be at the table because we've worked to be there. I come with my womanhood not because I am weak or I'm less deserving than my male counterpart. We are treated the way we are because we are shy and timid about our womanhood. We see it as a weakness. When you have a period pain, you feel guilty. Why are you feeling guilty? It's part of your normal physiology. Why are you apologizing? No, I can reschedule a meeting because this is where I am. This is how I feel. I'm not canceling. I'm rescheduling it because mentally I'm not in the right frame of mind. So when you need to be your own advocate.
Yeah.
You have to own your own body and understand that the things that you're going through are normal and they're physiological.
Yeah.
When we start making excuses and not owning our body and our own health, we are seen as weak. If you present yourself as weak, that's how people are going to see you. You having preeclampsia is because you were carrying a child. It was something out of your control. So no one can judge you for it or see it as a weakness because it was something that was outside of your control. And a man is not ever going to have preeclampsia because they don't have a uterus. Yeah. So you have to own your own health, your womanhood, and not see it as a weakness or use it as an excuse. You have to be your own advocate.
Definitely, and I wish it was as simple as
I know.
Because you really know that meeting has to happen. If you cancel it, you'll be in trouble. But going back to screening, Doc, right? So most of us, when we screen, we obviously screen for certain things. But let's talk a bit about fibroids. How do you then know that maybe my period pains are more than just period pains? And how do we then start with that awareness of what fibroids are and what really it entails? Like you said, a lot of us, when you have period pains, you have a bit of pains here, here's grandpa, you'll be fine.
Yeah. So fibroids are slow-growing tumors in the uterus. They grow slowly and they grow bigger over time. When you start realizing that your period is becoming unusual, first your period will come every month. You know it comes every 28 days or so. It lasts for 3 or 5 days at most. And then when it changes to either you now bleeding twice in a month or in between your cycle or passing clots or having to change a tampon or pad every hour, it's full and it's disrupting your life. You have to call in sick for work. You can't go for exams, but your period becomes irregular and heavy and your period pains become excruciating. Where normal Panado used to help with the pain, now you need more medication. Then I think it's time to get checked out. Some women will have bloating or their stomachs will start to grow as if they're pregnant, even when they're not pregnant. It's because by that time, the fibroid has grown to the size of a baby inside your uterus. So that's when I think you should get checked out.
Yeah. And once you're checked out and you realize you have fibroids, what are those treatments? Is there treatments to help you? And what are the impact? Does it impact your fertility?
Okay, so in terms of treatment for fibroids, we have what we call medical treatment, which doesn't entail surgical. So it's either medical treatment or surgical treatment. In terms of medical treatment, it depends what your symptoms are. As I said, some people will have bad period pains or they'll bleed in between their cycles. So if you're having pain, excruciating pain or irregular bleeding, you can either use non-steroidal pain medications like your Panados, your Brufens, or we can stop the bleeding if we need to stop the bleeding quickly with medication. And the depot injection render most women amenorrheic, meaning that they don't bleed. So those are the injections and the medication. And depending on the size of the fibroid, if it's below the umbilicus, there's treatment modalities like when we put ultrasound beams on the fibroids to shrink it. Depends on the size. If it's too big, you can't do that. Or radiation. And if you still are wanting to have more children, if all that fails, we can do what we call a myomectomy, that is to remove the fibroids by operation, either by cutting on the skin or by camera surgery, removing the fibroids. And if you've completed your family and you're an older woman, we can remove the whole uterus. So it depends where you are. Are you done with your family or not? what your symptoms are, then the size of the fibroids and the symptoms.
Okay. All right. So in terms of fertility, the impact of fibroids, is it like something that will cause you to not be productive or?
Yeah. So in terms of fertility, yes, fibroids can affect fertility. It depends where they're growing and the size they're growing at. Some people may struggle to fall pregnant if they are impeding the implantation of an egg in the center of the uterus. But if they are outside or they are pedunculated, meaning they are not inside the lining, they're outside, you may still be able to fall pregnant. But with pregnancy comes a hormonal surge. Your hormones change and there's more blood flow to your uterus. And remember, more blood flow means more growth for the baby, but also for the fibroids. So pregnancy can actually accelerate the growth of the fibroids. And depending, again, the size and location of the fibroids, the baby and the fibroids may fight for space, or there might be enough space for the baby, but it depends on the size and location of the fibroids. And it may also pose a risk of going into preterm labor, all of that stuff. So that's in simple terms as to how fibroids can affect fertility.
Okay. So working in a very high pressured environment, for example, medicine is one of those. I've watched you guys. I appreciated medicine and doctors when I had to be bedridden. But obviously accountants and lawyers and just generally, I think the workplace has just become a bit toxic as well. So, and most of us are taught to say, pursue, pursue, pursue. And when we pursue, we keep on shifting that goalpost when I'm having kids. Obviously, to those who want to have kids, to have the option to have kids. So how do you manage that pushing and pushing and pushing? I'm one of those who pushed. I have an 18-year-old and now I have a 3-year-old and a 2-year-old. So the gap. And it really came at an expense because obviously I experienced a lot of things. And I didn't really think it will. Obviously I was like healthy. My first pregnancy was fine. And then boom, in the other pregnancies, it was such a nice exercise. So when do young professionals who consider to have children have to start really questioning and asking themselves about pregnancy? And obviously there's a lot of options. Like I know that there is like egg storing, all those that you will tell us about.
Yeah. So, I mean, for me and my colleagues, it was different.
Yeah.
There was a cohort of us that decided that, you know what, I'll juggle all of it at the same time. So I had my 2 kids during my training. And there are those who decided, you know what, I am going to sit back, build, have kids, then go to training. And then there are those who were like, let me go through the training, study, finish. When I'm done with everything, then I'll have kids.
Yeah.
Okay, so everybody is entitled to choosing how they do it. True. There's no right way to do it. But if you know that you want to push a career, you want to delay having children, there are options, as you've said, in terms of preserving your own fertility, where you can do preservation of your eggs, freeze your eggs. So freezing your eggs just means that in my young age or in my prime, I'm going to retrieve my eggs and freeze them. That just means that your eggs will remain the same quality in age, regardless of how old you grow. So if I preserve my eggs when I'm 30, because I'm still pursuing a career, if I decide that, okay, at 40, I'm ready to have kids. If I decide to use those eggs when I'm 40, I'll still be using eggs from a 30-year-old myself. So the quality of the eggs remains intact, because as you grow, the quality of the eggs decline, and that puts one at risk of having miscarriages, because the body usually rejects abnormal pregnancies. That's the cause of most miscarriages. So as the quality of egg declines, you're at risk of having Down syndrome babies, you are at risk of having abnormal babies, you're at risk of having the miscarriages. So you can do egg freezing. And if that's not an option, there's egg donation. So if you're older, it's safer then to use an egg of a younger person to fall pregnant. But there's no right way to do it.
Yeah.
But at least now there are options of preserving your eggs and using them at a later stage.
And it becomes also an awareness, rather you doing it out of ignorance and pushing career, which is fine, but maybe coming back to really question and say, when do I want to have children and what does that entail?
Yeah.
If it's going to be later, it's okay, but let's understand that there are numbers behind this. And
Yes.
those numbers I saw when I then have had my children, I think I was 36 or 37.
Yeah.
Then I'm treated as a high risk. What
Yes.
does that number mean? Because I just felt like I'm fine.
Yeah. So as you grow older, you are at risk of developing other illnesses. Like the more you grow, you're at risk of getting high blood pressure, sugar, diabetes. Your body is not really as strong as it used to be. And as I said, the quality of egg reduces, right? For instance, when we define infertility, the cutoff would be at 35. So if a 35-year-old has been trying to conceive for 12 months and nothing is happening, then that's when we start to worry and investigate. But after 35 years, we at least give you 6 months. If after 6 months you're unable to conceive, then we start investigating and assisting you where you needed to be assisted. Because the older you grow, the quality of your egg declines and the quality of sperm at some point declines. But the quality of your eggs is declining. So if you're struggling to conceive, we have to then intervene. 12 months for those who are less than 35, but after 35 then less time to conceive, 6 months, because you can either fall pregnant or you can't. And the earlier we intervene, the better. And most fertility centers will prefer eggs that are younger than 40. After that, then they advise that you use donor eggs because of the egg quality. And then there are other issues. You are high risk, as I said, because of the illnesses that may come into play. And pregnancy tends to unmask other illnesses. Like you might have not had high blood pressure before pregnancy, but because of the changing fluid volume and your blood system, your heart's changing, your body is changing. Because of that and the toll that pregnancy can take on your body, your blood pressure changes. And if you develop preeclampsia in pregnancy, you're at risk of having chronic high blood pressure, meaning high blood pressure outside of pregnancy. So because pregnancy can unmask or precipitate certain illnesses, you become high risk when you're older because already your risk is going up. Yeah, so you become high risk in terms of that sense. But yeah, in the past, we used to call women older than 35 advanced maternal age. And for that reason, then you get categorized as high risk because of the risk it comes with.
Kate, makes sense. It does make sense. So in terms of like just thinking, obviously, as now you are high risk, what is things that you should look out for even as you plan to conceive?
Okay, acknowledging how old you are, that you can't do splits anymore, you don't have the same endurance. The pregnancy, as it grows, it reduces your lung capacity. So going up a flight of stairs is not going to be easier as when you're not pregnant. Just means that you are more vigilant. You attend your antenatal clinic consultations as prescribed by your healthcare professional, because there are important time intervals that you have to meet and do screenings at those times, right? A high-risk person will have more visit than someone who's low risk, and we'll do more screening for a high-risk person than we do for someone who's considered low risk. So you eat healthy, you take care of your body. If you're smoking, stop smoking completely, stop drinking, do regular exercise as tolerated by your body. Don't start something new in your pregnancy. Attend all the screenings and do all the tests that are required. The most important ones would be the screening for Down syndrome. As I said, the quality of eggs is declining. So it would be important to screen for things like Down syndrome in the baby, and to test your blood pressure at your antenatal visits, and to do your sugar tolerance test at your visits. And that time intervals will do the specialized scans to look at the baby's body. We call them fetal anomaly scans to scan for any possible abnormalities in the baby. But the important thing is to follow up as required or recommended by a healthcare professional, because we do important screening based on your risk profile at the time.
Okay. So for someone who says, you know what, I'm happy, I'm not considering to have children anytime soon, prevention, what are the options?
Okay, well, this is now a young person who doesn't want to fall pregnant anytime soon. Okay, I think now we jump into the topic of contraception.
Okay.
So we have what we call long-acting reversible contraception. So that's where I'd start with someone who brings that topic to the table. Long-acting reversible contraception just means contraception that you don't have to take on a daily basis. So this will include things like intrauterine devices, which we have the copper intrauterine device, which is a non-hormonal IUD, and the hormonal IUD, which we have the Mirena, and then the baby Mirena will be the Kyleena. They're all intrauterine devices for long-term contraception. So they will last at least 5 years, but you can take them out anytime before that if you want to fall pregnant sooner. And if you had children before and you don't want children anymore, you can do a sterilization. Okay. A sterilization just means we cut off the tubes that will prevent the egg from meeting the sperm. That's the sterilization. But the reversible one, if you think you might consider having a baby, the long-acting reversible ones would be the intrauterine devices. The other ones then are, you have the patches, you have the injectables, which include the Depo-Provera that everyone knows, or the Esterate, which is the 2-month injection. Or you can have the Implanon, that lasts. So these are contraception that you don't have to take on a daily. Okay. There are also the vaginal rings that you can insert, sits around the cervix for 3 weeks on and 1 week off, 3 weeks in, so you don't have to take it every day. And it's in for 3 weeks, and the patch is monthly. And then the other one would be the tablets. The tablets you have to take every day. But for someone who doesn't want to have a baby anytime soon, I'd recommend the long-acting reversible contraceptives, which are the ones that you don't have to take every day, that you either the loops last 5 years or the patches monthly. Those are the ones I'd recommend. But for someone who's still not certain, I might want to fall pregnant next month, then the tablet. Because the reason you have to take a tablet every day is because it's only effective for the time period. If you don't take it again tomorrow, you are not protected. Yeah. Yes.
And there's so many myths that comes with prevention. You find good to know you'll gain weight. No, this thing is not going to have your sexual experience won't be as good. Mm-hmm. So what are some of those myths and what is the reality?
The myths I've heard of is that contraception affects your fertility. It doesn't. Contraception doesn't affect your fertility. Once you stop contraception, depending on which one it is, you go back to what your fertility was before you use the contraception, right? So some people will stop the contraception and then they are struggling to fall pregnant for other reasons. Other reasons being you either might have contracted an infection that might have blocked your tube, or your partner's sperm is non-existent. So people then tend to blame contraception for that. It's not true. Yeah. If you're struggling to fall pregnant for a while, you need to get checked, investigated, assisted as needed. The other one, so it depends on the contraception. The people will react differently to certain contraceptions, and the contraceptions are hormones, and they're in different formulations, in different doses, depending on why you are using the contraception. So some people will just use contraception just to prevent pregnancy. Some people will come, they say, my cycle is irregular and I have acne breakouts. There's a different contraception I'll give to you who's having skin breakouts, as opposed to someone who just wants to prevent pregnancy. The reason you're having breakout is because of the hormonal changes in your own body. And contraception really are just mimicking your own hormones. So if I want to counter the acne breakout, I have to give you then a tablet or formulation that will counter the hormone that is most likely to cause the acne breakout. So I can't give you the same contraception. It's not a one blanket approach. And the side effect profile are different because the contraceptions are different.
Yeah.
If you're coming to me already and you have a low libido, there are hormones that are known to reduce the libido. And their contraception, as I say, there are hormones. You at least have to give the contraception method at least 3 months to see how it works, how your body acclimatizes to it before you change or judge to say this one is not for me. I can't take the side effects. Because after 3 months, either your body acclimatizes or really, really you are having bad side effects. Then you can go back to your healthcare professional to say, this is what I'm experiencing. Then we change it. So the two main hormones are estrogen and progesterone. They are the ones that go like this, and they are the ones that regulate your cycle. And in simple words, they can cause the skin breakouts, your progesterone. The estrogen is the one that causes your boobs to be painful. So they're different. They have different effects depending who it is and what your symptoms are. So it's not a one blanket approach. So if you have mood swings, I can't give you a contraception that has too much progesterone per se, because that's the hormone that's mostly the culprit of your mood swings. So I can't now give you a contraception that has this particular hormone because it's going to worsen the symptom. So I have to tailor the contraception based on your needs and your symptoms. It's a whole science behind it, but people think
It's
contraception is one same pill for everyone, but it's not.
And I think it's also who we ask. I think we'll
Yes.
quickly ask your friend. So
Yes.
what do you use?
Yeah.
Or we also ask Dr. Google.
Yes.
And maybe obviously topics like that are not something we always talk about. So
Yeah.
definitely we need to advocate for our health.
Yes.
Because it affects a lot of things.
It does.
Maybe moving to the taboo topic that we also don't talk about, sex and women's health.
Yeah.
What would be your advice in terms of that?
Sex is supposed to be pleasurable, right? If there are interpersonal issues, right, sex for women will start in the head, yes, and it's supposed to be pleasurable. So it's an interplay between your brain, your hormones, your pelvis, your vagina, and the connection between two people. Starting from the bottom, if you are having pain during intercourse, it could be a symptom of something that is changing in your pelvis. The common one being endometriosis. Endometriosis is when the lining that's supposed to be in the uterus is implanted elsewhere other than in the uterus. So you can have a period literally from either your umbilicus. Your umbilicus, belly button can bleed and have a period because endometrial tissue is implanted there. Or in your stomach or on your ovaries, when that lining implants there, it bleeds inside, it causes inflammation, and it can form cysts, right? So during intercourse, it might be painful because there is this inflammation or what we call a nodule, or things are stuck together inside because of this inflammatory process, endometriosis, and during intercourse, it becomes painful. When you're having painful intercourse, is not supposed to be painful. If you're having painful intercourse, you need to get it checked out. Last week, you're having pleasurable intercourse. In the next few months now, you want nothing from your partner because sex is no longer pleasurable. Get it checked out. And this will often be associated with very bad period pains where you're slouching or crouching in a bed and you don't want to get out. Okay. Yeah. And when women grow older, during the perimenopausal transition and into perimenopause, when the estrogen dips, the lining in your vagina becomes thin. Okay, so it no longer becomes as wet during foreplay. Then the skin down there is prone to getting cracks. You are prone to getting recurrent urinary tract infections because that lining on the vagina and where the urethra is, the urine hole is, becomes thin. You get recurrent urinary tract infections. sex is not pleasurable because it's dry, it's painful. It's because of the transition and the declining hormones. You need to see a doctor, because if it starts affecting your relationships or your sexual health, there are creams and there's hormone replacement therapy. You don't have to live a miserable life, right? If you don't understand anything or anything is amiss, you need to see a doctor. Get it checked out. Let's make sure that there's no big cysts that is growing in your pelvis. There's no endometriosis. The skin there is still intact. Are you transitioning? Do we need to replace the hormones that your body is no longer producing or not? Sex is supposed to be pleasurable. It does start in the brain. Some people have a low libido as a side effect of some contraception, which is fine. Let's talk about it. Let's find a solution. But yes, let's talk about our sexual health. It's just as important. It's part of your holistic care.
I just love the way you put it. So nice, simple. It's like, okay, you can call the V word so
Vagina.
easy.
It's a vagina, and our kids must call it the vagina. Because if they don't,
I'll
someone
let
else
my
is going
daughter
to
listen to this
name
one.
it something else, and then it's like speaking in codes. No,
Yes.
we're talking about the vagina.
Because it has a name.
No one must touch your vagina.
Yeah.
Your vagina is your private part. Let's keep it like that. But we must be able to talk about it, because once we like tiptoe around it, they won't be able to ask you questions. Something is wrong. How are they going to say? Something is wrong down there. Down where? Is it your toe? Is it your knee? What are we talking about?
Yeah.
It's not a swear word.
It's not.
It's the same as saying your eye.
Or your hand.
Your hand.
Yeah.
It's an anatomical name for what we call private part. That's a vagina.
Okay, thank you, Doc. I'll let my daughter listen to this one. But still on the topic of sex, obviously sex brings other side of it, which could be infections, sexual transmitted disease. What would be your advice on those issues?
First, the conversation has to start at home in safe spaces, talking to our children about safe sexual practices, discouraging promiscuity, and talking to our children about sex, the purpose of sex, what sex is, and how it's supposed to feel like.
Yeah.
And not being shy to talk to our children, because if we can't talk to them, they won't be able to come to us. If it's a taboo topic at home, there's no safe space. We are then giving room to outside influence to have more influence and more say on their decisions and their behaviors. So we need to provide those safe spaces for our children to openly talk about sex. Even us, I find that adults still also struggle to talk about sex. So we must provide safe spaces, the same way I just say sex and vagina, and I'm not cringing, and I'm not like, it's because it's not taboo.
Yeah.
It should be part of our everyday conversations. Safe sexual practices, having one partner at a time, using condoms. If it's a boy child, the father has to show the boy child how to use the condom. Advocate for your human papilloma virus vaccination, which is a vaccine that helps prevent cervical cancer. Not just for cervical cancer, but our Department of Health is targeting girls of 15 years and up for the vaccination, because cervical cancer is more prevalent than other cancers. It can cause other cancers like your throat cancer. They can have cancer on the buns. It causes other cancers. It can cause warts as well. But mostly we have vaccine. The vaccine program is for girls, but the vaccine is also available for boys in the private sector. So we start vaccinating young boys and girls from the ages of 15. Yeah. And just teaching our children about the different discharges. If there's a yellow, foul-smelling green discharge, it's probably an STI. And providing those safe spaces. And I always encourage self-awareness. What is normal for you and what is going out of the normal? Yeah. If you see something growing that you've never seen last week, you have to be curious. You can't just, because it's not painful, you can't just walk around with something that's a foreign thing on you and you're not curious as to what is this thing that's growing, right? Know what's usual, know your norm, you know the smell of your own discharge, you know the smell of your own vagina. If something goes out of place, be curious and ask, yo, mama, something is off. Please help. What must I do? Is there something wrong? I'm not used to this. Ask the right questions about your body, not just for young girls, but you as a woman, you must know what is normal for you and what is not normal.
Thank you so much. So in terms of obviously growing up and age, there's like menopause. When does that start? Is it like normal for everyone? And how do we know that, you know what, the clock has been really working hard?
So perimenopause can start anytime from the age of 40.
Okay.
The average age of menopause would be from the ages 45 to 55 on average, but perimenopause can start anywhere from 40. So perimenopause is the season before menopause. It's a transitional period where your period, they come and go, you skip your cycle, or you start having hot flashes or brain fog or insomnia or mood swings, right? But you're still having your period, but they're not that regular. When a point comes where your period has stopped for 12 months, then you are menopausal, provided that is happening after 40, because before that, that's abnormal. Then we need to investigate and treat accordingly. Okay. And then in menopause, as I say, your skin will start sagging, your skin changes, you struggle to lose weight, you gain weight, your vagina becomes dry, your pelvic organs can prolapse because of the decline in those important hormones. Yeah. So perimenopause is the period during the transition. Menopause is once you've stopped your period and then you can't have babies anymore. You can still have babies during the transition period when your period is irregular. So you can either start hormonal replacement, there are other treatment. It depends what your symptoms are and what's affecting your quality of life.
Thank you so much, Doc. So we've really learned from being young to now menopause. But what would be your final words of advice to women and obviously men in terms of women's health and what really needs to happen in terms of making sure that we remain aware and we also advocate for ourselves?
As I say, self-awareness is very important. Doing screenings is important, both men and women. Understanding your body, how it works, what to expect at different stages of your life, and what is important to look out for and to check out during your different stages of life. Be informed so that you can be a participant and not be a passive person in agreement when you go into the consultation room. If something bothers you to a point of you making an effort to get out of your bed, get into your car and drive to your doctor, if it's that important, you need to invest in yourself, be well informed, ask the right questions, right? And whatever you learn, pass it on.
Yeah.
Share the information, like safely so. What works for you might not work for the next person. But if you had a good experience with a good doctor, make the referral. Say, Mari, you're expressing the similar symptoms I had when I was going through 1, 2, and 3. I think you should get it checked out. We need to provide safe spaces for conversations, be it for children, girls, boys, men, women. We need to provide safe spaces for each other with no judgment. And through every stage of life, there's something that you just need to be aware of. Be self-aware, understand and know your body, and do the appropriate screening. Don't wait to feel pain. Don't wait to feel sick. We don't do screenings because just for fun. Yeah. They are preventative measures so that you can have a long, healthy, fulfilled life.
So we are on Numbers Don't Lie podcast. We definitely need to know a bit of any number that we want to share with us. Can be personal, can be medical, or numbers.
Okay, because we are talking about screening, the numbers that come into mind is the 90, 70, 90. It's the World Health Organization goals for the elimination of cervical cancer. So it just speaks to your primary, secondary, and tertiary prevention of cervical cancer. By 2030, the WHO wants to have screened at least 90% of women. But let me get it right. 90% vaccination, that's primary prevention. Secondary, 70% then will be screening. So it's vaccination, 70% of girls. I must get it right. No. I'm not good at numbers. So the 90 is the vaccination. The 70 is the screening, because our screening uptake is so bad. At least 70% of women by the ages of 35 and 45 should have been screened at those ages. And 90% then speaks to the treatment. Once you have cervical cancer, at least 90% of people must be able to get treatment. So 90, 70, 90. 90% is the vaccine of girls. 70% is the screening uptake. 90% is the treatment. Because the screening is not as great as we should have it. If you were to ask your friends, among your friends, how many people have had their pap smears, you'd be shocked. And our treatment access is so poor. There was a backlog of chemotherapy and operations in our public system. So we just need to get better at that and be part of the global movement into achieving those WHO goals.
And both me and you, we have a very much responsibility to ensure those numbers. Take your daughter, carry yourself to a doctor, please, because it's for your own good.
Yeah.
So thank you for sharing those numbers. At Numbers Don't Lie, because if we don't do that, we really stand at a chance of risking our own health. Thank you so much, Doc. We really appreciate you. We always have something goodies from 130 brands that has nice proper stuff. So please come to Numbers Don't Lie. You are guaranteed a nice package. And please look out for our clothing, dressed by 130 brands.
Okay.
So please look out for our clothing line that is coming up very soon. And indeed, Lord, help us number our days to gain understanding. That was the episode on Numbers Don't Lie. Thank you.